Hello, everyone. This is Dr. Anthony Uwandu-uzoma again. Thank you for stopping by for this session. So, in this today's session, I'm going to discuss how to plan interventions in public health, planning of interventions in public health, and specifically, we are going to be discussing the use of the COMBI model and the behavior change wheel to plan interventions that are um, very effective and acceptable to the target population. So quickly, the reference materials for today's discussion have the behavior change wheel technique taxonomy. Okay, so just type it in Google and then you'll be able to download that. And then you have the Michi et al. Publication called the Behavior Change Wheel, a guide to designing interventions. So you really need to read this book. It's very, very important. That is at the core of our discussion today. So the main reason why you need to stick to the end of this video is because um, it's going to be a very practical thing, and especially for students, for postgraduate students that have been in public health that are studying uh, the behavior change wheel, and they are finding it difficult to understand, how to, link the COMBI model with the behavior change wheel, and then with the logic model, and then getting the whole planning of the intervention. Sometimes it can be very, very stressful to understand how all these concepts are, linked together. So this video is, I'm going to make it very, very short, very concise, such a way that if you watch to the end of this video, you'll be able to understand in few minutes and be able to utilize this in your essays and in your projects and your dissertations. Okay, so this book is at the core of today's presentation, and then there are a couple of articles that I will be referring to in this presentation. First article is by Catherine Murphy et al. Using the COMBI model and behavior change ways to develop a theory and evidence-based intervention for women with GDM, that is gestational diabetes. So this article, I used some of the materials here just to show you how to fit in the whole picture. Then the next article that you need is you need to get this article here, Mapping Intervention Components and Behavior Change with Techniques. So, and then I think there's one more article that you need. Yeah, so three articles in total. Using the behavior change way to develop an oral hygiene self-care intervention. Okay, so these are the articles that I'm going to use, and then I'm going to compress this whole this mystical COMBI model and make it in a way that you be able to understand it in a few minutes. So let's get started with what I have here. So the behavior change wheel. So this is at the crux of today's discussion. So this is the behavior change wheel developed by Michi et al. So now at the center of this wheel, these are the things that can influence our behavior: the capabilities, the opportunity, and the motivation. So we call it the COM. Okay, COM, that means capability, opportunity, and motivation. And then the B is means behavior. So that means if you want to change behavior, you either influence capability or influence opportunity, or someone's capabilities, or you influence their opportunities or you influence their motivation. Now, this capability is divided into there are two types. We have the physical capability, the psychological capability. Now, for the opportunity, you have the social opportunity and the physical opportunity, while for the motivation, you have the automatic motivation and the reflective motivation. Okay, so now I'm going to break this in down a little. So now, this capability, opportunity, and motivation. That is the COMBI model, right? Now, the this model is mapped to interventions. So you see the red area are the different various interventions that you can use to influence the capability, opportunity, and motivation. So for the capability, you can influence it by using models or changing the environment, environmental restructuring, or placing restrictions. So these are the relevant interventions to change someone's capabilities. Okay. Now, for the opportunities aspect, you can influence. You can design an intervention to educate or to persuade, or you can provide incentives. So these are the areas that you can use to uh, change opportunity levels for a targeted population. Now, for the motivation area, for you to change motivation, you can intervene by either enabling the person, providing various forms of enablement, or providing training or coercion. So this red area are the various interventions that you can use. And then the outer part of the Combi model is the relevant policies in place that you can use. So now, if you want to influence opportunity, okay, what are the relevant policies for opportunity? You can environmental and social planning. So policies at this level, and then communication and marketing policies can also influence someone's opportunity. Okay. Now, if you want and then you can see that somehow there's also an overlap in this area. So there are a total of 7 policy areas. So if you want to influence motivation and opportunity, you can see that legislation can contribute on both sides. Okay, it can affect someone's motivation and also affect someone's opportunity. Okay, so you also have service provision, regulation, fiscal measures, and guidelines. So these are the 7 policy areas that you can use to influence behavior, and these are the 9 intervention areas that you can use to influence behavior. And then capability, motivation, and opportunity. These are the intrinsic areas. That means the individual areas that you can also use to change behavior. So now, before this is just a brief overview of what Combi model is all about. So now, but we also have a different model again as a framework. I'm trying to break down what do you mean by capability, what do you mean by opportunity, and what do you mean by motivation. So that framework is called the TDF. That means the theoretical domain framework, and this is what the framework breaks down, helps us to really identify what do you mean by capability, what do you mean by motivation, what do you mean by opportunity. So this framework, this picture is gotten from the article by Mitchell Richardson et al. And this is the article titled "Using Theoretical Domain Framework." Okay, so each of these COM-B, that's the COM, the capability, opportunity, and motivation, they are mapped to a particular TDF domain, and that is exactly what I'm showing you here. So capabilities under the TDF domain, under the TDF framework, capabilities there are things that you can influence to improve one's capability. So we have either increasing the knowledge or the skills of the person. Okay, the knowledge or skills to manage a symptom or to deliver a service. Okay, so when you increase knowledge and skills, automatically you are improving the capabilities of the person. Okay, so that's the knowledge and skills part of the TDM framework. Now, and knowledge and skills also cuts across both physical and psychological capabilities. All right. So now, motivation, like I told you before, in the Combi model, you have reflective motivation and then you have automatic motivation. So what do you mean by reflective motivation? That means consciously, what someone does consciously, how someone views a thing. So now the TDF framework helps us to break this down more. So you can see you have beliefs about consequences of an activity. Okay, so beliefs about consequences of an activity. For example, how the person perceives an illness or severity or susceptibility. So beliefs about consequences of an action or consequences of a behavior. Okay, so that gives us an idea of on what is reflective motivation. Now, automatic motivation is habits, emotions, things that someone does reflexively. That's like by reflex, automatically. So habits that can uh, influence behavior. Okay, so you have emotion. Emotion can cause that. Okay, and then reinforcement. So if someone has had a previous experience with something, or if someone has a previous bad experience about something, so that bad experience will also act as a reinforcement. Okay, to for that behavior. So that's automatic motivation habits. Now you have the opportunity. So opportunity in Combine model is divided into social opportunity is divided into two. You have your just a minute. Yes, you have your social opportunities and you have your physical opportunities. So, social opportunities, these are the influence of peer groups, influence of your social networks, social anything within the society that can influence you. That means other people, other people's lifestyle, behavior, um, acceptance, societal acceptance. Those are social influences. So, and then you have the physical opportunity, which are uh, environmental structures and resources. So under physical opportunity, you have things like access. So access to a service, access to HIV screening, access to TB screening. Okay, access to information, access to care. Okay, you have things in the environment like lack of privacy. Um, availability of staff. So those are under physical opportunities. So the TDF framework, that means the theoretical domain framework, it helps us to specifically identify what do you mean by capabilities in the Combine model, what do you mean by motivation in the Combine model, what do you mean by opportunity in the Combine model. Okay, so this is just a brief overview of theoretical underpinnings. Okay, so now we move straight to the planning of intervention. All right, so I quickly compiled this just to be able to help us to understand how the steps in planning an effective intervention using the Combine model and the behavior chain wheel. So now, according to Michi et al., there are 8 steps in planning of an intervention, so which I have summarized so that you'll be able to pick it up because it looks complex initially, but if I explain it, you'll be able to understand it, like, and just in a very simple way. So what is the first step in designing an intervention? The first step is to understand the problem and the behaviors. Okay, so I divided this into stage 1, stage 2, and stage 3. Okay, so stage 1 has steps 1 and 2. Okay, stage 3 and stage 1 has steps 1 and 2, and then 3 and 4. Then stage 2 has steps 5 and 6, and then stage 3 has steps 7 and 8. Okay, so now basically, how do you define a problem? So the step one is to define the problem in behavioral terms. Step two is to select target behaviors. So how do you define the problem? So how do you know what the problem is, what behavior to target? So first thing you need to do is to what? Gather data, gather behavioral insight data. And how do you do that? You do that by what? Organizing focus group, in-depth interviews with key informants. And these key informants can include healthcare, depending on your type of research, it can include healthcare providers. You can actually organize a stakeholder workshop where you invite the leaders of the Ministry of Health, the directors of hospitals, clinicians, policy makers, in different areas, so that you'll be able to know, okay, how what is the current practice. Okay, so let's say you are looking at let's say you are looking at relevant interventions for hypertension, or you want to improve the screening rate for malaria in pregnancy. So you need to have a meeting with the stakeholders, organize a stakeholder workshop. And the aim of the stakeholder workshop is to identify, understand their views about the current state for malaria screening. Okay, for malaria and pregnancy screening, for example, you want to understand their views on the policy, at the local, national, and international level. You would like to do at this stage. You need to do some literature reviews to know, okay, what are the kind of interventions that are effective for this kind of population. So now the population that we're using now, for example, in this tutorial, can be maybe pregnant mothers, and then you are looking at planning an intervention to increase the uptake of malaria screening in pregnancy, okay, in low income countries. So I'm just assuming that. So now you need to explore the relevant policies, okay. So as you are discussing, as you are having this focus group or in-depth interviews, so these policymakers, these key informants, they will give you an idea on the current policies that you find out if they are adhering to the policies, if there are any challenges with adherence. You find out, is there any existing policy, any local policy in place. Okay, so you find out their views, understand what their perceived facilitators and barriers. Okay, what are the things that can prevent people from changing their lifestyle? Are there any health system barriers, any patient-related barriers? What is the feasibility of the new intervention that you want to start? Is it possible that they can integrate this intervention into their existing uh, health structure or other activities, programs? Okay, so these are the things that you get when you're doing these focus group discussions or in-depth interviews with key stakeholders. You want to understand their views on the feasibility of your new intervention. All right. So having done that, you also interview the um, the pregnant women, okay, who are at risk of what? Malaria in pregnancy. So you need to interview them using focus group discussion or in-depth qualitative interviews, so that you'll be able to assess what are their barriers, what are their are they willing to accept a new intervention, how feasible, do they have any risk factors, do they have any barriers. And as you are doing this, remember you have your COMBI model and you have your TDF domains. Okay, so these are the kind of questions that you can ask. So for example, like I told you, capability in COMBI model, there are two types. You have the psychosocial and the physical capability. So you can ask is the questions like, is remembering the steps for XYZ. So let's say remembering your antenatal appointments, is there a problem? Or what are the challenges that you have in attending your antenatal visits? Okay. Okay. So for physical capability, you can ask questions like, are there any additional skills you need to adhere to the guidelines? So during these interviews, both with the target population and with the stakeholders, you are trying to find out what are their psychosocial capabilities, what are the physical capabilities, what are the barriers and the facilitators, okay? Um, Reflective motivation. A question you can use is malaria in pregnancy a priority? So if you're asking key stakeholders, you can ask them those questions. Okay. Um, Automatic motivation, you can ask something like, are there any emotional states that affect you or prevent you from attending your antenatal clinics or attending your malaria screening tests? Okay. Do you then, for physical opportunity, do you have access to clinics, or you have access to places where you can go for your malaria test in pregnancy? Okay. Social opportunity, what's the influence of your peers, okay, or your fellow pregnant mothers on your attendance to antenatal visits? Okay. To what extent does working as a team improve or hinder your behavior? So this is using the Combi model to frame your questions for in-depth interviews and focus group. So, but me, I prefer to go straight to the TDF, to to map my questions to the TDF domains, and these are the TDF domains for capability. So you have knowledge, memory, attention, decision processes, and behavioral regulation skills. So these are the TDF domains. If you are assessing capability, you can ask questions to assess their knowledge, their attention, memory, if they can remember their antenatal appointments. Okay, so your questions should be framed. If your questions is anything around these areas, that means that you are asking to assess their uh, barriers and facilitators in attending the antenatal visits. So you are asking those questions to determine their level of capability. So for motivation, the TDF domain, the TDF domains for motivation here, you have your emotion, reinforcement, okay, social professional role. That means how you see yourself can also affect your beliefs about your capability. Are you able to attend antenatal care, or do you feel like, are you shy? Or then also you have beliefs about the consequences. Beliefs about the consequences. Goals, optimism, intention. So there are questions that you can frame around these areas to assess for motivation. Okay. And then you have the TDF domains for opportunity. So social influences and environmental context. So these are two ways of viewing the same problem. Okay, so anyone that you feel comfortable with working with, if you would like to map your questions straight to the Combi model, Combi questions, then that's fine. If you want to further break them down to using the TDF framework so that you'll be more specific, then that's still fine. They all end to achieving the same purpose. So by the time you have done your focus group interviews, you have done your stakeholder workshop, you have discussed with, you have already understood the feasibility and the relevant opportunities for your intervention. Next, you select the behavior. So now you have understood what is preventing them from engaging in a good health behavior, and what is and the possible ways to facilitate them to engage in that behavior. So you go to steps 3 and 4. So steps 3 and 4, it says that you should select the target behavior, identify what needs to be changed. So you need to identifying what needs to be changed. First of all, you need to select the target behavior. So, and then you identify what needs to be changed. So how do you select the target behavior? Just like we discussed before, by the time you have done your interviews and you have analyzed the transcripts, you have analyzed them, then now you know the various problems that your target population have. You now understand the barriers and their facilitators. Okay, so all you now need to do was classify them into the domains: capability, opportunity, and motivation. and then also into the TDF domains. So these are also just the some questions that also help you to map to the TDF domain. For example, when you say, do they have the knowledge and skills required? That will map to the TDF domain for capability. Okay. When you ask, do they have access to information that they need? Which domain does that map to? That maps to environmental context, okay, and resources. Now, do people around them and the social environment support the behavior? That is also people. That means social influences, okay. So that maps also to onto our opportunity, okay. Do they think it is useful? How do they think? How do they see it? So that will likely map to reflective motivation. So that will map to, that means beliefs about capabilities. Okay, so how do they say it? So that maps to TDF domain for motivation. Do they have a clear plan on how to do it? That is about goals. Okay, so that maps to motivation again. Do they have an indication that this behavior is a priority? How they feel? Is this something that is important to them? So that will also map onto goals again. Okay, do they receive any reimbursement for that behavior? So that will map onto reinforcement, and that is also under the TDF domain of motivation. You see that? So motivation on the TDF, and that also maps onto the COMBI domain of also motivation. So by the time you have done your interview, your focus group discussions, then you analyze everything, then you classify them under the TDF domains and the COMBI domains. Okay. So now the step 4 is identify what needs to change. So among all these problems, which one needs to change? Which one needs to change? So for you to identify that, you just use, is there need to change? You say yes or no. Yes. Okay. So you can now say, okay, for this particular behavior, it needs to change. You write yes, in a table. So let me show you an example of where this was utilized. So I told you my reference is this article here, using the behavior change way to develop an oral hygiene self-care intervention. So you can see here the author now having identified. So these are the steps that I've already done before. So stage 1 is to understand the behavior, and you can see the behavior, define the problem. So the behavior was adequately specified, and then specify the target behavior, including the frequency, duration, and technique. Okay, and then specify the target behavior that you want. Okay, and then, like I was saying in step 4, identify what needs to change. So here the behaviors were mapped onto COMBI components, so they were not mapped onto the TDF framework. So it's all about what choice, what do you want, which one do you prefer working with? Okay, so they are all mapped onto the COMBI model, and he said, is there a need to change? Yes. So you identify the behaviors that need to change, and that is how the author identified the behavior that needs to change by indicating yes. Okay, so you now have the last step. Sorry, not the last step. Now the next step is what? The next step is this stage 2. That's step 5 and step 6. So you now identify the potential intervention functions using the behavior change wheel. So now that we have identified that all these need to change, we need to map all these into the relevant intervention function. So we have what we call the the intervention function matrix tool. Okay, so instead of me to use the behavior change wheel the way it is, so you can see that there are some overlap here. So But using the matrix tool will help me so that I will not be making guesswork on a mapping. So you can see that some of the policies and intervention, they overlap each other. Can you see this one here? Capability overlaps in restriction and education. So because of that, I need to use a matrix to have a clearer picture. And this is the matrix here. You have the intervention function matrix tool, and you have the policy matrix tool. So if you identify the problems and then you map them to the COM-B components. So let's say that the problems that you identified was that psychological capability is a challenge, okay, for the woman, for the pregnant mothers attending antenatal clinic. So they are not aware, they don't understand the reason why they should be attending antenatal clinic for malaria screening pregnancy. Okay, so you see that when you mark this, so you see that this table here is already uh, developed by Michi et al. So now you look at the table and you see that for psychological capability, you can use education, one. You also look at here again, you can use training, two, and then you can use enablement. Okay, so that means that we have three options for this woman. We either choose to educate them, or train them, or enable them. So which one can we do? I don't know. So I'm assuming that the major challenge for this woman is that they lack knowledge, okay? And that is under psychological capability. So now I have 1, 2, 3, okay, enablement. And then another challenge that they have is let's say reflective motivation. So that means that um, they don't see themselves as like for me to understand what is reflective, they feel like it's not necessary. So their emotions, they feel it is an extra stress, going to the hospital again for antenatal checkup. So, and what I can use to address reflective motivation here, I see that education is here again, persuasion is here, incentivization is here, and then coercion. So these are the four things, okay? So now I need to list all my intervention options, and then what I'm going to do now is to do what? Use the appease criteria to say which one in the context of, based on the context of my research of my intervention, which one can I do? And here is an example of how the author did it in his work here. So you see here, he listed out all the interventions options. Having identified the problems, the behavioral challenges here, he now used the matrix tool, which I've shown you already here, to now match which ones can I do. So, and for you to do that, you need to use what? The APIS criteria. So what does the APIS criteria, what does it stand for? It stands for what? Affordability, practicability. So it means it's asking the intervention that you want to design, is it affordable? Is it practicable? Is it effective? Is it cost effective? Is it acceptable by the population? Does it have any side effects? What's the safety profile like? And then is it equitable? Okay. So, for the women that are that are pregnant that are attending antenatal care, I want to improve their attendance to antenatal care for malaria screening in pregnancy. Okay, so, and I have listed the possible interventions. Okay, So I will now say which one, based on the API's criteria, which one can I do based on on the local context of this implementation? Which one can I do? I will now tick yes, no, and select the ones that I can do. All right, the ones that I can implement. So that's your step 5. Now, step 6 again. What are the policy options again? So here you also use the uh, the APIS criteria here. Look at them. This is the matrix tool again. Matrix tool. So these are the policy categories that can address the problem of attending antenatal checks for malaria screening in pregnancy. So I know that since the problem is that is lack of knowledge, and then I am using education as a tool. So and this is education here. So which policy category falls under education? So you can see I can use communication or marketing, I can use guidelines, I can use regulation, I can use legislation, I can use service provision. So among all this listed for education, which one do you think I can use? Which one do you think I can use? So I know that I may be able to use communication / marketing, and then I'll be able to use service provision. These two, okay, based on the APIs criteria that I showed you before. So let's go back again to the behavior change wheel. So the pregnant women attending antenatal care, they have an issue with they are struggling with their psychological capabilities are limited. So I can use any of the options here, either modeling, environmental restriction, or restrictions. Okay, can also use um, that means under intervention I can use any of these, but then under the policy I can use regulation, fiscal measures, guidelines, and environmental planning. So, but when I use the matrix tool, it makes it clearer for me. Okay, what the options are. So, and that is why we need to use the matrix tool. Okay, so since the problem is knowledge, and then I want to use education, so which one can I use inside the policy here? Is either of these options here marked X. Okay, so based on my context, the context of my research, I know that I can easily either I can work on the service provision, or I can work on the communication and marketing. So, like I said again, you use your APIS criteria again. Which one can you do? So you can see this the author here. He was able to the team they were able to select just communication and service provision as the one that they can do based on the APIS criteria. All right. So having done that, then you now go to, so we have done this. So the next one is we now identify the behavior change techniques. Okay, so for us to identify the behavior change techniques, I told you, just download. I think we have up to more than. Let me just check. So just download behavior change techniques. Okay, just taxonomy of behavior change techniques. So taxonomy of behavior taxonomy of behavior change techniques. Okay, so once you download the article, you will see, once you download the document, you see different, there are up to 93 behavior change techniques. Okay, So, and they also have their definitions. Okay, so you can see these are the different behavior change techniques. So which one is relevant for to improve knowledge from all this now? Which one is relevant to improve knowledge? So now I can see shaping knowledge. Shaping knowledge, I can either do 4.1, 4.2, 4.3, or 4.4. So which one can I do? I can select that based on the context of my program, using the APIS criteria, I can instruct people on how to, how to go for their antenatal checks. Okay, in terms of the frequency and the importance. So if I click on that, so you have an example here. Okay, so on how you can actually do it. For example, advise the person how to put on the condom. So now in our own context here is to advise the woman on the need for antenatal care. Okay, so show her how to use the antenatal card for her appointments and to set a reminder on a reminder about going for her malaria check. So you set instruction on how to perform a behavior. Okay, so among all these four steps, which one can I do? I cannot do a behavioral experiment, but I can do instruction. So skill training. All right. So that is for shaping knowledge. So the behavior change tool has a collection of 93 different behaviors that are categorized into 19 different domains. Okay, so now based on the problem that you have identified, you can now choose the specific behavior that you want. So if the problem is they don't see it as a priority, for example, which is what goal set, which is under goal and planning. Now I need to find out which one can I do, which one based on the context of my implementation, which one can I do? I can say let's say, yeah, review of behavior goals, for example. And this is an example here. Okay, so I can help the woman to set a goal to see how we can help her to adhere to antenatal visits and also to do her malaria screening test. Okay, once she's going for the antenatal care. So we can set a goal and set a reminder on that. All right. So the you need to learn more about this by reading the book by Michi et al. On using the behavior change wheel and the COMBI model. So they explained different the common behavior change techniques. There are ones that are very common that you can use. Okay. So now let's continue. All right. So once you have identified the behavior change technique in particular that you want to use, you now list them. Okay. Then the last step is to identify the mode of intervention. What's the mode? Who are the providers? What's the setting like? What's the tools? What's the duration, frequency of intervention? So I'm going to show you an example. So this example here is from the author. Yeah, I think, the example here is from. Let me just open the article so that we'll just go straight to it. Okay, so this example is from Catherine Murphy et al. Okay, published in 2023. So it's a recent article, and they did a very good work here. Okay, okay, so you can see, sorry, in this picture, let me zoom this picture so that you see it well. So in this picture, you see a combination of the COMBI model with the TDF domain, the theoretical domain frameworks. Okay, so you can see under capability, you have you have knowledge, cognition, memory, behavior, regulation. Okay, so this is just like a way of combining everything together. Okay, they're all aimed at achieving behavior change. Okay? So, and these are the explanation of each of the codes here. All right, so you can read more here on the article. Is an open source, open access article. You can learn more about it. So, like we said, we are trying to now do, and also, by the way, the steps that they utilized in the behavior change wheel process, they are all here. So you can also learn from them. Okay, and then, so I was trying to say something about the logic model. I think the last step. Okay, give me an example. Identify the mode of intervention delivery. So, like I was saying, this example is from this author, Catherine Murphy. So, you have they have identified the various challenges, the facilitators and barriers, and they broke them down using a combination of the COMBI model and the TDF framework. So, and then they were able to map it up into the they were able to map that with the behavior change technique. Okay, they were able to map that with the behavior change technique. So, for example, when the problem is lack of knowledge, and this is what lack of knowledge looks like, they are not well informed about some about relationship between GDM and type 2 diabetes. They have some misconceptions, and they are receiving conflicting messages from care providers. So that is what lack of knowledge looks like. So now, for you to increase the knowledge, what do? You provide a training on what is diet and the role of glucose and insulin. So these are the issues that these are the activities that are supposed to solve the problem of knowledge. Okay, and the intervention in the behavior change wheel is what? Education. Okay, so that is mapped onto education. And now the behavior change technique is 5.1. So let us see what is 5.1 here in the behavior change technique document that we downloaded. 5.1 is what? 5.1. Let's see what is 5.1. 5.1 is, can you see, is information about health consequences. See that? So this is information about health consequences, and this is what it means here, to provide information about health consequences of a behavior. And then they gave us an example to provide explanation about not finishing a course of antibiotics. So how did the author present? So they used what? A brochure on diet. They gave counseling and peer group uh, discussion, and they use visual aids. Okay, so you have to adapt the behavior change tool according to the program that, or the intervention that you are already designing. So that is 5.1. So education. So to solve the problem of education, of educating the women, or increasing their knowledge, they use the behavior change technique 5.1. Okay. Now you have, that's knowledge. Now you have let's just go straight to knowledge. Yeah. So here you have cognitive and interpersonal skills. That is a TDF domain. All right. That is still under uh, under capability, psychological capability in the COMBI model. So to address the problem of skills, they used training. So skills is mapped to training. And which behavior change technique is relevant for training? You have 4.1 and 15.2. So let's check in the document 4.1 and 15.2. So 4.1 says what? 4.1 says instruction on how to perform a behavior. You see, so that is training. Okay, 4.1. And what's the next one? Next one is 15.2. 15.2 15.2 is mental rehearsal of successful performance. So that will address the issue of self-belief. So let's see what it looks like. 15.2 mental rehearsal of successful performance. Let's see what the example looks like. So he said, advice on imagine eating and enjoying a salad in a work canteen. so let's see, how did they apply it in the article? Mental rehearsal of successful performance. Let's see. So what they did was meal planning tips. Yeah, okay, meal planning tips. Okay, so let's see, what is the definition? The definition in the document here. The definition of 15.2. Where is it again? 15.2. Let's go back to 15.2, mental rehearsal of successful performance. So 15.2, advice to practice imagining performing the behavior successfully in relevant context. Is that what they did? I want to see whether that's what they did. Okay, I can't see anything about imagining here, but I'm assuming that mere planning tips can help them to imagine on uh, uh, what a healthy diet looks like. So this is just a brief overview of how to do this practically. So having mapped out the behavior change techniques and then selected the relevant intervention that you want to do, maybe Michi et al. They suggested maximum of two behaviors to target for that to be effective. Okay, then that brings us up down. That brings us to the end of using the model, the behavior change wheel. So we'll now go straight to planning. Now we know the one or two target behaviors that we want to change, and then we need to now plan on how to do that. So for us to plan on how to deliver the intervention, we need the help of a logic model that shows us how interventions flow from how our inputs, how our intervention is going to have a change in the behavior of the target population. So a logic model is just something like this here. So you list your intervention, one or two interventions that you want to do. Then you specify the behavior that you want to target, and then you specify so sorry you specify the factors that cause that behavior. Okay, and then you select the behavior that you want to change. Okay, and then this is the overall goal, which is reduction in harmful behavior. So let's just go to example. So from the same author, from Catherine Murphy et al., we'll just get their examples of their own logic model, view size. Okay, so this is their logic model, what it looks like, and I like the headings. It makes more sense to me here. Problem input, intervention activities, behavior change, and primary outcome. Okay, so the problem here is um, the rates of obesity, GDM, and type 2 diabetes are rising in the target population. The women have a higher risk. There is no provision of follow-up and support postpartum. Postpartum screening are not accessible and they are inconvenient, and then they also have barriers to lifestyle change. They have misconceptions. All right. So these are the problems that we have identified after doing all this. So what do we do to solve the problem? We need inputs. So inputs will include staff. So we're going to train nurses and lay counselors, and you're going to give them skills on in brief behavior change counseling, give them a manual, then continue to support them, give them a leaflet. Okay. So the first one is training, and then the second intervention that they did was development of intervention. They now develop the intervention. And what is the intervention actually? Individual educational counseling on lifestyle, which includes diet, physical activity, self-care. We have family support, peer support, and then giving them information on GDM and risk behavior. So these are the two major uh, inputs here: the training and then to develop the intervention. And then these are the activities. So under training, these are what the these are what the author and his team did. Okay, and then you have to develop an intervention. The intervention that they developed was what counseling sessions in the hospital and the clinic. Okay, majorly, and then provided them with leaflets, and then um, with three peer support groups. So one thing you need to know here is under the activities you have to be very specific, both the timeline and the number. So if you watch, you see that the nurse and lay counselor said two to provide two 15 to 20 minutes antenatal education and counseling sessions. Okay, so you have to be specific, the quantity, the duration, and the intensity. So that was what that. So that is what we have here. Planning, specify the logic model, allocate resources, and then give feedback to your stakeholders. And then the last step is to prepare for the implementation. So you employ and train implementing partners, develop intervention resources, and then consult the management and staff at research sites. So that is that. So to go into more details about logic model, then you need skills of project management. So, but the video is almost 1 hour. We're going to stop at this point. But I hope that with this short video, you'll be able to write an essay on how to plan an intervention. Okay, so make sure you read this article here just to get further clarity. Read this article by Catherine Murphy et al. Okay, and then read reads the article by Mitchell Richardson. This article here by Mitchell Richardson, and then make sure you get this book, The Behavior Change Wheel: A Guide to Design Intervention by Michi et al. Try and read them. So when you read them and then you come back again and rewatch my video, this whole Excel sheet summarizes everything in a simpler way. I can practically take this Excel sheet and then use it to develop an intervention for myself. So that is the purpose of this video, to compress knowledge and to make it what? Accessible to all. So my aim is to what? Is to make complex knowledge very simple. Okay, so gather a whole lot of things and then compress the knowledge and make it easily accessible. So you can chat me here on LinkedIn, ask me any question. You can comment on the video or other topics that you are feeling complex, too complex to understand, and I will have a look at it, especially if you're a public health student. Uh, I would like to work with you then. All right, thank you and God bless you. I still remain Anthony Uwandu-uzoma. I'm currently a Cochranian Year 3 mentee, and we are continually building capacity. God bless you. Bye.